One 21st century healthcare development is the invention of medical robots. Robots have been around for a while now, but the work they do in the medical field is amazing. Robots used for heart procedures like cardiac caths and electrophysiology ablations are changing the medical world. Humans are not perfect, and no matter how awesome a doctor is, mistakes can still happen. The goal of a cardiac robot is to be so perfect with every movement so no mistakes happen. For example, sometimes it is hard for a doctor to see everything he needs to see when inserting a catheter into your veins and having it travel all the way to the heart. Sometimes it's hard to see the blocked artery, the hole that needs to be fixed, or the exact spot that needs to be shocked for the ablation to work to fix arrhythmia. A cardiac robot can see everything perfectly. The movements are down to the 1,000th of a millimeter of perfection, so it will go down to the exact spot it needs to get the job done. Cardiac robots are awesome for doctors. These surgeries can take hours, so if a robot can take some of the workload, doctors won't be as tired and they can take breaks. There is also less radiation exposure for the doctor. The Corindus CorePath system is the first FDA-approved robot for surgeons to use. During a CorePath procedure, the surgeon sits in a radiation-shielded work area and uses a set of joysticks and a touchscreen to control the movements of the device. The cardiac robot is so perfect with measurements and movements that it goes to the exact spot inside the veins, artery, and heart, and have the procedure be successful. For example, it will go to the perfect area to destroy the tissue that is allowing the bad electrical signals causing the arrhythmia. Without the robot, the surgeon would have to use dye and X-ray images to see the area. It's a big guess sometimes. The robot can be much more successful than a human eye. The success rate is much higher, and the procedure is much quicker. The doctor can do all of this with less radiation. The robotic device can do all sorts of cool things in the cardiac Cath Lab. It can locate the exact place a blockage is in a vein or artery. It can balloon it out perfectly, and it can place stents. Another advantage of the cardiac robot is sometimes it can let a patient have a procedure done using it instead of open heart surgery. Open heart surgeries means the doctor has to cut open your chest and the bones in your rib cage. And the doctors have to put you on a machine that does your breathing for you. And then they do the surgery and sew you back up. You have to stay on the ventilator for a long time after the surgery until you're strong enough to breathe on your own again. And you're in the hospital for a long time. If a cardiac robot can help you avoid an open heart surgery, that is a really great thing. The Corindus CorePath system is awesome, and it's doing great things for doctors and heart patients. I can't wait to see how it improves. Even more and more technology is invented to do even more great things for people with sick hearts.